New report from leading public health organizations urges states across the country to significantly increase tobacco taxes to reduce tobacco use and also save lives and generate billions of dollars to fund tobacco prevention. As you're probably aware, our state is already a leader in this department. The tax rate for cigarettes, e-cigarettes, vapes, nicotine patches, and chewing tobacco are 95%. That includes products designed to help people quit, like gums and patches. Joining the conversation now is Brian King from the Campaign for Tobacco-Free Kids. Brian, welcome to ARC Seattle this morning.
Thank you. Happy to be here.
Of course. So what are some of the key findings in this new report that you guys did?
So the bottom line is that states are shortchanging efforts to prevent and reduce tobacco use nationally. Currently, states are meeting only 20% of the recommendations that CDC provides to effectively reduce and prevent tobacco use. And that includes Washington State, which currently ranks 42nd in terms of funding. But the good news is there's a solution, and that's increasing the price of these products to help reduce consumption.
42, wow. Is there actual evidence that tobacco taxes, like the 95% tax here in Washington State, really reduces tobacco use? What does that data show?
Yeah, so the available evidence at the international, national, state, and local level all overwhelmingly shows that increasing price is the single most effective intervention for reducing the use of tobacco products, including cigarettes. And just as an example, in Washington, there's currently a proposal to increase the tax on cigarettes. A $2 increase in that tax would prevent 5,700 kids from smoking. It would prompt 21,000 adults to quit, and it would also raise $56 million in revenue in the first year alone, which in turn could be used to fund critical public health programs to further save lives.
And Brian, we know a growing number of states like Washington are taxing nicotine cessation products like patches or gum. Would your group consider that counterintuitive, since the goal of some of these products is to get people to quit?
Well, of course, it's important to remind people that these products are proven safe and effective. And so you want to make sure that you're creating an environment where those products that have been FDA approved and safe and effective are going to be as easily accessible as possible. That said, we know there's no benefits when it comes to the risks of tobacco products, particularly cigarettes. And so it's critical we do everything we can to increase the price of those products, while also making sure there's accessibility to these lower risk alternatives and FDA approved products like nicotine patches.
Obviously, there's been a lot of discussion this past year over federal cuts from the federal government and how that's impacting states. Are we seeing federal cuts in this area? And if so, what's the impact of those?
Yes, absolutely. So we're at an unprecedented time, an apocalypse of federal tobacco prevention and control activities. CDC's Office on Smoking and Health has been fully eliminated by the current administration, including key health communication campaigns that have helped people quit and help prevent kids from starting. And so now more than ever, it's critically important that states step up to make sure they have fully funded programs and implement the science-based, evidence-based interventions we know work.
Talk about maybe some of the short-term impacts of that and also the long-term. If the federal government is cutting money that states can use for these types of prevention programs, what's the short-term impact and maybe long-term?
Well, the short term we've already started to see with many states closing their tobacco prevention and control programs, since they were largely funded by CDC's dollars. And in addition, the longer term is the adverse effects on the health of this country. We know that 500,000 Americans continue to die from smoking-related diseases each year, and for every one that dies, 30 more are living with smoking-related disease and death. It remains the leading cause of preventable disease and death in this country. And so it's critical now more than ever that everybody steps up, but particularly at the state level, given the decimation of federal infrastructure, to help address this completely preventable health risk.
All right, Brian, thanks for the letting us know about what's happening across the country and certainly the impact here in Washington State this morning. Appreciate your time.